Okay, so next, we're just getting set up for Helen Christiansen. You all know her as Helen, I believe, unless you're using your other alias. Moms, maybe. She's going to be talking about planning a pandemic simulation exercise. Is that what you gave me this? I have. Did anybody else get one of these? Did you put it in your bra? Michael? No? Yes. Okay. So have your papers out of your bras, and I just going to say I had my paper in my bra. So everybody, if I can have your kind attention, Helen.
While serving as a chief public health officer in the Public Health Agency of Canada. So my presentation today will cover some of the basic considerations for pandemic exercising, as well as a discussion of vulnerability and risk. But before I get started, I want you to consider your own personal risk during a mock sleep and simulation pandemic that we're going to have right now. So you're all given a piece of paper earlier. Alright, so recall the number. For those at home, just think the number between 1 and 5. So, pandemic.
Yeah, okay, good. No cheering, no celebrating. Cut it out. Okay, so, pandemic risk. Hands up if you got a 1. You guys are healthy. You escaped. Okay. Hands up if you got a 2. So, family member with moderate illness, all right? Number 3. Okay, so you experienced moderate illness. Number 4, hospitalized family members, all right? Number 5, so you guys are hospitalized. And, okay, now this is the tricky one. So, 6. Michelle.
Wait a minute, she can't answer.
Now, Michelle gladly volunteered to be my 1 death based on the assumptions that are attached to this simulated pandemic. And these assumptions are what I used in my exercise design, and they're based on percentages, which I'll talk about later. But, so Michelle, thank you for volunteering to do that. So the risk you experienced was randomly assigned. The good news is that we don't have to rely on chance to dictate our risk. So what is a pandemic simulation exercise? A pandemic simulation exercise, it tests an organization's pandemic response plans. This involves creating pandemic scenarios that are realistic and which are based on what we know about pandemics, what we expect to differ in pandemics, and the potential events or situations that could occur. Now, TV dramas depicting the widespread catastrophic aftermath of the disease-infected walking dead are entertaining scenarios of what could happen if a novel influenza virus strikes. The CDC used zombies as a simulated public health emergency to help the population plan for emergency preparedness. Skipping that one. So who is responsible? Oh, I'm going to back up here. There we go. I'm missing a slide. Oh well. So who is responsible? It's basically everyone. The answer is everyone is responsible for pandemic planning, but the mandate rests with internationally the World Health Organization, and federally it is the Federal Health Portfolio, which is the Public Health Agency of Canada. The provinces and territories have immediate responsibility for public health emergencies, but they do collaborate with the federal government when it becomes a multi-jurisdictional event. I'm going to try and find my other slide. Hang on. Yeah, anyway. Okay. All right. So there are many functions, activities, and roles that need to be filled during a pandemic and which need to be exercised. My role as exercise director was to design, implement, and evaluate an exercise that would test these components that, of pandemic exercising. The first component is the public health response. So one of these components, and these include, wow, not with this here. Here we go. Public health response includes surveillance and reporting, the use of vaccines and antivirals, individual and community-based actions, which are like social distancing, hand washing, border and travel restrictions, communication of risk, and the transfer of knowledge between health sector partners. Another component is business continuity and the ability to address surge capacity. All areas of healthcare will be heavily impacted by a severe pandemic, and organizations must ensure that plans are in place that identify critical services, succession plans for key personnel, and the ability to maintain resources. Not only the healthcare system will be impacted by a pandemic, but also social services, all areas of government, and the private sector. I think we already did this one. This is the one I got messed up on. All right. In designing a pandemic exercise, my first steps were to assess where the department was at in terms of experience, knowledge, and skills. It then became a matter of identifying the availability of key players and the time frame in which I had to conduct the exercise. And ensuring the availability of the key decision makers, such as the ADM and the Chief Medical Officer of Health, were the factors that led to the exercise occurring only just a few days ago. It was the day before I left to come back down here. The pandemic exercise that I designed for the Yukon government wasn't a zombie apocalypse, much to my children's disappointment, but was based on the current H5N1 virus. But it had an artificially injected mutation that allowed for human-to-human transmission, which the current virus does not have. The assumptions of what would occur clinically with this virus were based on past pandemics and included a 45% attack rate, that's the percent of the population that would be affected and represented in our numbers here, a 20% hospitalization rate, and a 2.5% mortality rate. I must note that the current H5N1 virus on the low side is 56% mortality. And but that's without human-to-human transmission. So if we applied that actual number to what happened today, all of you with number ones, approximately 30 of you, would have succumbed to the virus. So it can show how serious it can become. Okay, pandemic exercise ptarmigan, and that was the name of the exercise. And any guesses? But it was to do with the northern chicken. That's why it's the ptarmigan is the northern bird of the Arctic region, so that's why we went with exercise ptarmigan. It was to improve operational readiness and performance, to clarify roles and functions, and to identify any gaps or weaknesses, improve communication within the department. To create a realistic pandemic exercise, you have to inject events that could possibly occur during a pandemic. An example of an inject is having the Chief Medical Officer of Health become infected and unable to fulfill his role. This leads players to discuss succession plans and considerations for communication continuity. During exercise play, assigned observers were recording exercise discussions using checklists and recording whether or not measurable outcomes were met. Following completion of play, Players participate in a hot wash, or it's a debrief, which allows for discussion and written feedback. Okay. Pandemic planning and exercising would not effectively mitigate risk if it did not consider the determinants of health and vulnerability. Earlier in the presentation, you experienced the outcomes associated with pandemic risk. Those outcomes would not be equally represented in groups who have increased vulnerability. Equity in pandemic planning considers and plans for the increased risk that vulnerable groups face. The overall goal of public health is to minimize death and disability for all. In order to achieve this goal, we must employ a social justice perspective to identify those groups who face disproportionate risk. In past pandemic events, the focus was on protecting the medically vulnerable. But now it is becoming standard practice to consider vulnerability in the context of the social determinants of health. To consider vulnerability, it is essential to assess a population's unique needs using a holistic approach in the context of the determinants of health. To use an approach that is collaborative and participatory. In addition to the considerations of vulnerability and increased risk, there are several practices and strategies that need to be addressed and included within pandemic planning and exercise. These practices include the interoperability of international, federal, provincial, and territorial plans, the establishment of collaborative practices, business continuity planning within all sectors of government, non-government organizations, and the private sector, the use of social media within communication plans to address the rapid spread of misinformation, to mitigate panic, and to provide risk communication messaging. At the policymaking level, pandemic exercising must be prescribed and direct departments and branches to make available key players and that are critical in the testing of the plans. Design teams must ensure that all sectors and groups are included in pandemic planning and exercise design. During our practicums, I challenged my fellow classmates to identify within their placement organization if there existed pandemic plans or business continuity plans. This challenge is for all who work in public health, whether we're beginning our careers or whether we're deeply entrenched. We must ensure that we fulfill this core public health function to ensure that our organization is pandemic ready. While the Public Health Agency of Canada and the World Health Organization may take the lead in a pandemic emergencies, it is incumbent upon the whole of society to become involved and engaged with pandemic planning and exercising. As a society, we also need to look to the broader issues of health inequities and vulnerability in order to reduce our pandemic risk. Although I must say that if we do not prepare, we might be solving the health system issue with, less people available to stress our system, but not an ideal situation, absolutely. And lastly, I would like to thank my practicum supervisor, Kathy Fredrickson, and my mentor, Chris Balza, with the Yukon Department of Health and Social Services, my colleagues and the professors for all your support and advice, and my family for having to not have me home for 4 months. So thank you, guys.
Okay, we have a question over here from our studio audience.
It's not a question, it was more of a statement. It's great because Helen, we did this collaborative project in our second semester on disaster management, and it's great to see that you took that further because it was something that we didn't know very much on, so it's great to see that you took that further. Oh, yeah.
And since Helen's not going to toot her own horn, I'm so proud of her because she did such a fantastic job in her practicum placement that they hired her on.
Thank you.